Hello, I'm Maritza Barone and welcome to my wellbeing podcast, Things You Can't Unhear. As a radio and TV presenter with a focus on wellness, I've interviewed very many health professionals in my time and heard stories and journeys that are eye-opening to say the least. But I found the best bits and the bits that I take home with me, the things that have changed my life, are usually when the camera shuts off and we can talk in length behind the scenes. And that's the information that I want to share with you on this podcast. Okay, so today I'm going to jump straight into my interview about all things fertility and infertility with the exceptional Dr. Lynn Burmeisiter. For those who don't know her, she's a qualified obstetrician, gynecologist, and if that wasn't enough, now a fertility IVF specialist at the top of her game with her own clinic in Melbourne called Number One Fertility, and her focus is to provide the best fertility treatment at affordable costs. She has made countless families' dreams come true by giving them the most important thing in their lives, and that's children. Hi, Lynn. Thank you for being here.
Hi, Maritza. Thanks for inviting me.
You're known as the fertility queen.
I know. Lucky me.
How good is that?
Yeah.
I've interviewed you briefly before, and
Yes.
I've followed your work for a long time.
Yes.
So I'm already a fan, but can you just give everyone a bit of a bit of background on your career and your philosophy?
Sure. So I finished medicine in the 1990s, and then I went into obstetrics and gynae training, and just fell in love with delivering babies initially. But then I met Professor Carl Wood, who was the founder of IVF in Australia, and he sort of took me under his wing and said that, you know, on the side, maybe I should start learning how to do IVF. And I just became very passionate about IVF as well. And then I went to America and trained in a big IVF hospital in New York City. So I spent 2 years of my IVF training in New York City, and then I came back and I started working back in Australia. And initially I used to do the IVF, and then once I got the patients pregnant, I used to deliver their babies. But about 8 years ago, I became so busy with just all the IVF that I couldn't do the babies as well. So my main focus now is getting my patients pregnant. We don't always have to do IVF, but about half patients that I see will do IVF and half will just get pregnant naturally. So I've been practicing in this area for about 20 years now. So I feel I am an expert in this area.
Oh, you definitely are.
Yeah.
And people are really talking about you at the moment as well, in a positive light. So you did say that you try and get your clients pregnant through other ways as well as using IVF. What are some of those ways that you do that through?
Yeah. So when a couple comes to see me, usually I've got their general practitioner to order all the basic tests for me. So on their first visit, I can sort of decide what that patient needs. So it may be that the patient's not ovulating, so then I can just give the patient an ovulation tablet. There are other things that a patient might complain about, that some women have very bad period pain, and it is endometriosis awareness month this month. And some girls might come in and say, I've got terrible periods, doctor, I faint, they're very heavy, I can't go to work. And those patients might actually be suffering from endometriosis. So with a patient like that, I'll take her to theatre and do a sort of a very simple laparoscopy, and diagnose endometriosis and potentially treat it. And then we've got oil now that we put through the tubes that actually has been shown to improve pregnancy rates rather than just putting the traditional water through the tube. So we flush this oil through called lipid oil, and it increases their pregnancy rates to 40% over the next 4 months.
Wow.
Whereas traditionally we used to just put water through, which increased their pregnancy rates to about 25% over the next few months. So the lipid oil is a fantastic new thing that can help our patients get pregnant naturally so they don't end up on IVF. So
I mean, it's great that you do offer these tests initially, that people don't have to go through IVF, because it can be quite a grueling process, can't it? Can you talk us through the process? Because a lot of us don't know. It seems to be quite a private thing that people go through. They don't want to share the fact that they're going through IVF in case something doesn't happen until they've got good news. So can you share the process with us?
And I think that's a bit of a shame. So what I'm trying to do is break down the barriers for people to talk about IVF. And that's why I've created my rooms in a way to sort of like make people feel comfortable. And I really want to break down that sort of barrier that they feel that they can't talk to people. I've got a big table in my rooms that the girls sit on before they come in for their appointment with me. And they actually now, and I've got a coffee machine, and now they actually go and make themselves a coffee and they sit around the table and chat to each other about their fertility journey, which I think it makes it easier. And what the patients have to go, it is quite hard and very, very hard. And to be told that maybe you may not be able to have a baby is devastating. And I said once, it's probably, you get out of bed every day and it's like wearing a pair of tight shoes every day, all day, because you can't stop thinking about it. And my patients they can't stop thinking about it. It's on their mind. It occupies them. It comes into their relationship. It does sometimes cause relationship issues as well. The patients usually, the process of IVF itself is probably not as bad as the thought around IVF that it may not work. I think that's probably worse for the patients. The patients have to take about 10 days of injections, and they have a couple of scans along the way and a couple of blood tests. And by about day 10, the follicles are usually ready. And what we do is we give the patient a trigger injection that she takes at home at a certain time. And then we collect the eggs usually around 38 hours after the final trigger injection. The trigger injection matures the eggs. So when we collect the eggs are mature, hopefully, and the patient goes to sleep for the egg collection. So they do have an anaesthetic, and we collect the eggs through the vagina using a very fine needle that passes into the ovaries and drains the follicles. The scientist is standing next to me while I'm collecting the eggs, and the eggs are constantly kept warm. So they go into a test tube warmer, and then the scientist looks at the eggs in like a baby incubator, so to speak, with a microscope, and she counts the eggs as I'm collecting them.
Oh, wow. It really is incredible what you do and the technology behind it. But I have heard that you have used acupuncture in your clinics to tie in with these IVF treatments.
Yes. So patients love acupuncture. There is some evidence for acupuncture on the day of their transfer, but a lot of the time I think it's a stress relief for the patient, and also they bond with their acupuncturist, and I think they enjoy going to their acupuncturist. And a lot of the acupuncturists, or most of them, have very good positive energy, and I think that positive energy also helps the process and helps them deal with the process of IVF as well, and may have an impact to their ultimate outcome as well. So I think anything to do with relaxing and around particularly your embryo transfer day, I think it's very, very important not to walk out feeling stressed and harassed after your transfer. So in my new rooms where our lab is being created, we've got acupuncture rooms and we've got massage rooms. So the patients just can decide. Some people don't like acupuncture because they've got needle phobia. So they can decide whether they want to book in for a massage or book in for acupuncture post their transfer.
It's interesting because a lot of the time we look at the women, the female in the partnership as the fertility problem. Is that what you're seeing most of the time?
I think we do forget men, but I always ask the men to come to their first appointment and any follow-up as well, because they're 50% of the embryo. And so I take a detailed history from the partner as well and make sure that they don't have any health issues. Particularly my number one beef is when they're smoking, because a lot of guys think that cigarettes don't hurt the sperm or the baby. But actually evidence is that men who smoke can actually affect the health of their unborn baby. So I usually, if a guy's smoking, I say to the couple, really, I don't think you should have any treatment until you've been off the cigarettes for a couple of months.
And it could be an easy fix.
Yeah. And sometimes I've had couples where they've just stopped smoking and they've got pregnant. So they've saved money from not buying the cigarette packs, and they've saved money from not needing IVF as well.
You're helping everyone all around, but
Yeah.
it's infertility numbers are, on the horizon are increasing at an alarming rate at the moment. And,
Yeah.
I believe the stats are 1 in 6 couples that are
Yeah.
needing help to conceive. Is that right?
That's right. So it is increasing. We're becoming more infertile. So men, we know that even a man's semen production has decreased from 100 years ago. So 100 years ago, men were producing around 100 million sperm per mil, and now the average sperm count is between 30 to 40 million sperm per mil. So it is dropping, and I think it's to do with our lifestyle, our environment, and what we do to our bodies as we're growing up as well. And like a lot of men in their 20s will, party hard, drink a lot, smoke cigarettes. That probably has an ultimate effect on their sperm production later on in life as well. So, and also what we're exposed to, radiation, pesticides, they probably affect our fertility as well.
I do want to talk about that in depth.
Yeah.
The pollutants and chemicals that
Yeah.
are within plastics and even makeup. And,
Yes.
that is the cause of infertility. It's been proven in many people. So
Yes.
what are your thoughts? How do we work around this so we're not led down this path?
I know. Well, I always tell my patients to be mindful of what they are drinking. So, it's probably better to go to the tap and get a glass of water than go to 7-Eleven and buy a plastic bottle with water in it. So, any patients that walk in a plastic bottle, I say throw that out because a lot of them have BPA in them. So, I'm very mindful to my patients about talking to them about what they're drinking and where they're drinking from, and also what makeups they're buying. So I try and get my patients to look at the labels, make sure they're, and particularly there are some organic makeup brands around now. So I ask them to look at the back of what they're buying and choose a fertility-safe makeup brand.
What is it in these products that is causing the EDCs?
It's the chemicals, the PBA chemicals, so that affect the eggs and the sperm quality. So it is the chemicals that they're using to make the plastics and to make the makeup that goes and ultimately affects the DNA in both the sperm and the eggs.
It's quite frightening because when you research this, it's things like washing fruit and vegetables and buying them from local sources reduces your intake. Okay, so we're thinking about our fruit and vegetables. We're thinking about what drinks we're drinking, the water from the tap even. We're thinking about what bottle we're drinking out of. Like there seems to be, oily fish intake, canned food. There seems to be so many things. And I think
I know. And it may be even, when we were children, we drank out of sippy cups, which were plastic and probably filled with toxins that, our mums gave us when we were children. So it could even be from when we were growing up that might be one of the impacts to our fertility later on as well. And also even when our mums are pregnant with us, the way she looked after her body affects our ultimate fertility as well.
As a mum of 2 little girls, I'm telling you, I'm like, alarm bells are ringing with me, and I'm hoping that I haven't, harmed my children. But it's not all doom and gloom because you are here and you are, helping so many families. What are the latest technologies and new developments with IVF these days?
Well, it's improving all the time and we're discovering new things all the time. So even the culture medias are improving. And now when I first started IVF, we used to put the embryo in very early, like either day 2 or 3, because we didn't really have great culture medias. But now we can actually simulate the culture media to the fallopian tube because the embryo takes 5 days to get down the fallopian tube into the uterus. So now we can actually simulate the same environment for the embryo. And so the culture media that we use has 2 steps. The first step gets the embryo to day 3, and then day 3, the embryo's got 8 cells, and then by day 5, it's got over 80 cells. So its nutrients are different. So a day 3 embryo needs different nutrients to get to day 5. So we replenish our culture media with the next step. It's called sequential media. So that's one thing that's improved over the last 10 years or so. The other thing that has improved is how we grow the embryos. So at Number One Fertility, we grow the embryos in time-lapse machines. So basically, rather than the scientists getting the eggs and the embryos out every day to do an assessment, we can just leave the embryo in the incubator system and push on the patient's name and push on every single embryo in that machine, and we get a video of what that embryo's been doing. So we don't have to get it out every day. That also reduces the risk of the embryo being exposed to light, because embryos actually are very sensitive to light. So it reduces the risk of the embryo also being exposed to the surroundings in the lab and any temperature changes. So the embryoscopes are amazing new development that aids our scientists in not only selecting the best embryo, but also looking after and nurturing the embryo in a very, very safe environment.
And does that
Yep.
also work with freezing of eggs and for people who are, just keeping their eggs on ice?
Yeah, so freezing eggs is becoming more and more popular. And I have a lot of ladies who are in their 40s, and that unfortunately they missed out on the whole egg freezing time, because up until about 8 years ago we weren't really good at egg freezing, but now we've got a new technique called vitrification, which is snap freezing the eggs, so the eggs don't actually get damaged when they're frozen. And so that's become more popular over the last few years, and my waiting room is full with a lot of girls between 30 and 35 that freeze their eggs. And again, they still have to go through what an IVF patient would go through. They take medication every day in injection form and then have an egg collection. Then the eggs are snapped, frozen and vitrified, and each egg gets stored in a single straw, so it's a safer way of doing it. And also if the patient comes back later on, she might only want to store 5 eggs rather than the whole 10 or 15 eggs that she may have stored.
For these people who are freezing their eggs, their age group, did you say 35 is the maximum age that you suggest
No, they
doing
can freeze. I have got ladies that freeze their eggs older. We would like them to come and see us before their 35th birthday, but we do have some ladies where they've got no other option. They might reach 38, they still haven't met anyone, and they come to see me as well to freeze their eggs. It doesn't work as well as patients are getting a bit older or closer to their 40th birthday, but it's an option for them. It's not covered by Medicare, and the patients usually have to pay out of pocket to freeze their eggs. So it's an option for them if they're 38, and I give them all the risks and complications and the potential stats of becoming pregnant from the eggs, and the patient feels that she still wants to proceed with it, I'll still egg freeze at 38.
Yeah, okay. You're right, though. We did, I'm in that age group, and we did miss out on that period when we were in that 30 to 35 age group, when the technology wasn't there. So
no, and a lot of ladies that I'm trying to get pregnant in their 40s, they say to me, I wish I had frozen my eggs. But I say, probably if you had seen me back when you were early 30, we didn't have the technology for you.
Exactly.
So yes, they have missed out. But it's good that I'm seeing a lot of girls more aware of it, and they are coming in and doing it. And it gives them an option. And what I've seen in my practice of the women that have frozen their eggs, they're using their eggs for their second baby. So they might have their first baby when they are 38, and that might have come along naturally. And then when they're hitting 40, 41, they come back and see me and they use their frozen eggs. So I've had that seems to be a common thread towards the egg freezing. So we will see more and more girls using them in the future. And I've even seen a trend to using their frozen eggs with donor sperm as well.
Right. And luckily for men, there's no real expiry date on their sperm, is there?
No, they're pretty lucky that way, although there is some increased risk of, chromosomal damage to the sperm as they're getting older, and a very small increased risk of autism after their 40th birthday in offspring. So there is some evidence that older sperm isn't as good as younger sperm, but not to the same degree as eggs with women.
Finally, what would you say to the younger generation now to help them protect their fertility for the future?
I would say look after the older person you're going to be, and there's certainly the lectures I give my teenagers, and so be healthy. Don't smoke, don't drink, don't take illicit drugs. If you're going to have a good, it doesn't mean that you can't have fun, but just don't go out and do the binge drinking every single night. So things like alcohol, smoking, illicit drugs can all affect egg and sperm quality. So I think average age for having babies now is about 33. So if you want your eggs to be healthy by the time you're ready to have a baby, then you've got to look after them in your 20s.
Well, thank you, Lynn, for an incredible insight. And thanks for being part of the show to educate our listeners on an easier fertility journey going forward. Thank you again, fertility queen, Dr. Lynn Burmeister. If you want to check her out online, her website is drlynnburmeister.com.au. Bye, everyone.